Well, good afternoon, everyone. Thank you all for being here. My name is Josh Parsons. I'm chairman of the Board of Commissioners, Lancaster County. First of all, I just ask a favor. Please turn any of your phones off during our briefing. First of all, I want to thank everyone, especially our briefers, for being here. We've got a number of people from the medical community. They're all very, very busy right now doing planning, as you can imagine, but we appreciate them taking a little bit of time to make sure that you all have the information that they have and as much information as we can get to the public. Our goal today is to convey as much information and as many facts about what we know in Lancaster County right now to you, the press, and also the public. I'll say that that's what we know at the moment, and as you all know, things are changing very, very rapidly. So we have the information that we have right now, but things are changing hour by hour. The first message that I want to convey to all of you and to the citizens of Lancaster County is that I've talked to many, many leaders over the last several days and weeks all across Lancaster County and across many different sectors. And they all recognize that we're in a potentially serious situation. But I also want to say that they all uniformly, to a person, have been calm, they've been serious, and they're all working very, very hard within their lanes and within their organizations to make sure that they're prepared. The tone is calm, careful, and collaborative. We're taking in county government every prudent precaution that we can right now. Our emergency management team, which is great and which is here and you'll hear from in a moment, are working very, very hard. They're preparing for multiple courses of action. We're prepared to take potentially serious steps if we have to, and these include standing up our Emergency Operations Center. We're prepared to issue a disaster declaration for the county if we have to, if that's prudent to do. We certainly hope that we don't have to do things like that, as serious as that, but I'm a former Army officer, and we always said hope is not a course of action. And our county staff and our county emergency management team is preparing for many different courses of action. I want to also say that we're communicating very well with our state and federal partners. We were on a conference call yesterday with White House staff. We've been on conference calls with the Pennsylvania Department of Health, and our emergency management team is staying in touch with our partners as well. Lastly, I just want to say that in Lancaster County, as you all know, we collaborate better, I think, than almost anywhere else. That's our strength. That's what we do. And that's how we're going to handle this situation too. We're going to handle it in a calm, careful, and collaborative manner with all of our partners and across all the different sectors in Lancaster County. And doing that together, we're going to get through this safely. So I thank you, and I'm going to turn it over to my colleague, Commissioner D'Agostino, right now.
Good afternoon, everyone. As Commissioner Parsons said, I'm Commissioner Ray D'Agostino. In addition to being a county commissioner, I happen to also be the chairman of the Board of Elections. So my comments today are going to be directed toward the election that we're going to be having coming up on April 28th. And like everyone else, the County Board of Elections is monitoring the COVID-19 or coronavirus situation on a routine basis. I would say really a constant basis. And we're taking guidance from the federal government, particularly the CDC. That is something we recommend that everybody do. We're also taking guidance from the state, Department of Health, which is, again, a prudent thing to do. But in our case, with elections, we're also taking guidance from the Department of State. And at this point, we want to emphasize that we're looking to create an environment of caution and not fear. And so the things I'm going to tell you are things that we are planning on doing with respect to the election as we are planning today, as we know this is a fluid situation. So in Lancaster County, we are seeking to optimize distance between people in the polling place. We're doing that by training our poll workers, having signs up, and discussing this amongst our workers and our staff. Number two, we are providing methods for poll workers to routinely clean surfaces which people come into contact with at the polling place. And for those who prefer to bring their own ballpoint pen, they can certainly do that as always. I will also say that we have in stock the materials that we need to make sure that we are doing what I just said, which is keeping clean contact surfaces. Number 3, we're encouraging everyone and providing the means in the polling location to maintain clean hands. It's important that we do that. You know, the guidance is to make sure we are routinely cleaning our hands with sanitizer, of course not touching our face, and again, limiting that contact, that social distance. Number 4, county already has backup locations for each polling location. That's a routine. We're now in the final stages of identifying backups to the backups. This is especially important in locations where we have polling places within residential areas of nursing homes and retirement communities. We are already planning to switch as necessary from those locations. And number 5, we want to remind people that in Pennsylvania right now, we have an option for mail-in ballots. And we encourage people, if they have concerns about going to a polling location at this point, that they can apply for a mail-in ballot up to a week before the election, which would, in this case, mean April 21st. And they can do that by going online to www.votespa.com. You can also go on the county's website under the Board of Elections and get to it from there. As a matter of course, we have backup plans to ensure the continuity of elections. And like I said before, in this case, we have backup plans and backup plans. I won't go into detail, but beyond having backup locations for polling places, we have backup plans for almost everything that we're talking about doing that I mentioned previously to make sure we have a safe environment for an election. And finally, I'm in routine, almost constant communication with the Director of Elections, Randall Wenger. And please know that Randall Wenger is not only regarded as one of the best directors of elections in the state, as far as we are concerned, he is the best. He is the most knowledgeable about elections. And anybody wants to know anything about holding an election in Pennsylvania, and particularly in our county, it's Randall. And we have full faith in him and our staff at the County Board of Elections. So thank you. I'm going to turn it over now to Commissioner Lehman.
Good afternoon, everyone. Thank you all for being here today. I'm sure we wish we were here under different circumstances. So I'm going to talk a little bit about 2 things. I'm going to talk about county government in general, and then I'm just going to speak to everyone who may have concerns at home. So first of all, probably one of your questions is, what's going to happen to county government as we try to manage this situation? So county government is a very diverse organization. We have 24-hour facilities like the jail, the Youth Intervention Center, the 911 Center, the crisis intervention, and things like that. And we have everyday departments like the assessment office, human resources, and things you might find in just any organization in general. So we were fortunate actually here in Lancaster County. About a month or so ago, we actually had a COOP exercise, which is Continuity of Operations Plan. And we had an exercise a month ago that actually allowed us to sort of refine our plans to make sure that if we did have a crisis in Lancaster County, that we would be prepared to deal with it. So since that time, our department heads have been updating their COOP plans. They've been making sure that they have a plan that if something were to happen inside county government and we would need to adjust operations in some way, shape, or form, we would have the ability to do that, possibly by allowing folks to work remotely, possibly by scaling operations to make sense, to minimize the contact that folks are having, and also to make sure that employees have the information that they need to be able to do their job in a safe way and continue county operations in an effective and efficient way. We have tried to keep in contact with our county employees on a regular basis to make sure that they have information, that they know that the Board of Commissioners is taking this situation seriously, to try and make sure that they understand what we're doing, why we're doing it. And we've also taken the extra step of taking a look at our HR policies and have a plan that if we need to revise them in any way, shape, or form to make sure that we're treating our employees and our customers with respect, we can do that in a phased and a responsible way. You know, An event like this is a really, really, really big deal, and I'm sure the folks watching at home know it's a really, really big deal. It's not often that you have a press conference of this magnitude with this number of folks across an array of sectors in our local community. And it's really easy for folks to sort of become a little bit panicked, a little bit concerned. I know from my own personal perspective, in times of stress, I always try to focus on, and it's easy to say, and harder to do, try to focus on things that you can personally control and not so much get caught up in what necessarily you're hearing and seeing in the media. And that is not to minimize the role of the media. That's not to minimize the severity of what we're potentially facing here in Lancaster County. But it is a call to make sure that people try to maintain themselves in a calm and collected manner as much as they can. So for the folks at home that are viewing this press conference or seeing reports of it later, my advice to them is focus on the things that you can control. Follow the CDC guidelines, follow the Department of Health guidance, follow the guidance that is out there. We've all heard it time and time again before, but cough or sneeze into your elbow, wash your hands with soap and water for at least 20 seconds, use an alcohol-based sanitizer if soap and water are not available, avoid touching your face. I can tell you folks, I've tried to avoid touching my face as we've been going through this situation, and it's a lot harder to do, and it's a whole lot easier to say. But it certainly has made me more vigilant in terms of just being aware of what each of us does every day simply because it's a habit. And wash your hands if you do touch your face. Clean surfaces frequently, including countertops, light switches, cell phones, remote controls, and otherly frequently touched items. Folks, focus on the things that you can control. Try to maintain yourself in a calm and collective manner. And by doing that, you're really doing yourself a big favor. You're helping to keep yourself safe while we're all trying to work collaboratively here to deal with this potentially very serious situation. So with that, I'll turn it over to Phil Colvin, our Emergency Management Director.
Good afternoon. So emergency management's role in this event or incident that's going on is really to provide support and coordination to the local municipalities and emergency services within the county. We're doing that by participating in weekly coordination calls with the Pennsylvania Department of Health, Pennsylvania Association of Hospitals, the local healthcare services within the county, and also the county commissioners. We're also in frequent communication with the Pennsylvania Emergency Management Agency and sharing information with them continually. We're continue to distribute information, vetted information that we receive to the local emergency management coordinators, the local municipalities, and also to the emergency services within the county. If the need arises and we start to receive supply requests or resource requests, or there's any unmet needs of any municipality within the county, we'll process them through our office up to the Pennsylvania Emergency Management Agency and try to get those requests fulfilled. We also have assisted with putting information on the county's website and also the emergency management website to guide people to the Pennsylvania Department of Health and the CDC, which really should be the only points of information that you're getting and sharing with everybody else. And lastly, what we're really going to need to be able to mitigate this problem as it continues to grow within the county is a high level of support from the public and everyone else to adhere to the mitigation actions that have been requested, such as canceling large events and staying away from large group gatherings. So as those come out and we get those from the Pennsylvania Department of Health, we'll certainly do our very best in our office to push it down and get it out to the lowest level of government, the townships and boroughs and the city within the county. So that's all I have now.
Thank you, Phil. Next, we have the medical briefing, and we've got 3 leaders representing the 3 major health systems that are in the county. So I can ask them to come up one by one or all together. It's up to you, gentlemen. But the first one I have listed is Dr. Joseph Contra, Chief of Infectious Diseases for Penn Medicine Lancaster General Health. Doctor?
Thank you. Good afternoon, everybody. My task this morning is to provide an update on how the regional hospitals are dealing with preparations for coronavirus for COVID-19. Um, Epidemic preparedness is not something that happens only when there are epidemics happening. This is something that's a perennial process, and any of our emergency managers up here can vouch for that. We've been looking at preparing for COVID-19 ever since the first cases were reported out of China at the end of January of last year. Specifically, we're looking at the epidemiology of this. Have been in preparation modes. We have seen epidemics before. Remember, we prepared for SARS and we prepared for Ebola, neither of which really hit this area. We did, however, also prepare for H1N1 back in 2009, and that did hit the area. And we got through it, we survived it, and we learned a lot from that epidemic preparedness. And it's worth recalling a couple of statistics from H1N1. Remember that about 57 million people were infected with H1N1 in 2009 into 2010. There were 237,000 hospitalizations and about 12,000 deaths. So that was a big toll. Numbers like that could be coming on the tail of the coronavirus outbreak. That's what we're trying to prepare for. So the regional hospitals have been taking a look at this. We've been preparing our physician's office, our frontline providers, our emergency departments, our urgent care centers, and our inpatient facilities for the arrival of COVID-19 patients. We've been trying to make sure that we have not only adequate staffing and staffing contingency planning, but also adequate supplies, gloves, gowns, masks, ventilators. Everything we have has become a precious commodity, and we're trying to really develop plans for how we're going to utilize those and how we're going to address the needs of our patients while at the same time protecting the health of our healthcare workers. So we meet regularly, and actually at this point almost continuously, to try and prepare. We're in touch with the CDC, the Department of Health, and also our Penn and other affiliated university hospitals around the county. The first pillar that we're trying to deal with is to keep people out of the healthcare system. Remember that about 85% of patients with COVID-19 will not require hospitalization. They can be managed at home and will do well. It's focusing on the 15% that will require hospitalization and the much smaller percentage that will require intensive care or ventilator support. How do we get ready for those? How do we plan for the surge of patients that may come at some point? And that's really been the focus of our preparedness. In keeping people out of the hospital, it's important that patients who are ill stay home. If you feel like you need to contact your family physician, that's the first place to start. We also have call centers set up to try and answer questions from the public. And the idea is to move to a scenario where we can provide outpatient testing facilities now that testing has become both commercially available and is ramping up in terms of capacity. And again, many patients can be cared for at home, and by preventing them from entering into the healthcare system, we can then protect other patients, especially those that are more vulnerable, as well as our healthcare providers. The second pillar is to limit spread once within the institution, and we have plans in place to sequester COVID-19 patients to a certain floor in our facility and to maintain their care with a specific highly trained healthcare staff. And finally, we want to make sure that we are managing our supply chain. Supplies are drying up, you've all heard that. Masks are very hard to come by. And all the supplies that we need, from gowns and gloves, goggles, everything is in short supply. So by establishing protocols to deal with this influx of patients that we're anticipating, all those things have to be taken into consideration. So one of the things that is most concerning about this particular epidemic, remember for H1N1, it played out really over about 9 months. And for COVID-19, we have about a 2-month time frame where we've gone from 0 to 127,000 approximately cases. We don't have a drug, we don't have a vaccine, so we have to rely on good old-fashioned public health. And that's where a lot of these recommendations are coming from. The idea behind social distancing, canceling large events like this one, getting people to maintain good personal hygiene, staying home when you're sick, avoiding those who are ill, all focuses on distancing patients from one another. We can stop the spread of this virus by not allowing the virus to find the next host. And that's what a lot of these social distancing maneuvers are aimed at. That's very important at this point, and although there's been some criticism of canceling large events, I think that is really the way to go at this point. We don't have cases in Lancaster County, but we will. I think that's inevitable, and I think when it gets here, we need to be prepared, and that's what we're about. Thank you.
Thank you, Doctor. Next up, we have Dr. David Gasparic, Vice President and Regional Medical Director with WellSpan Medical Group.
Good afternoon. So my task today is to talk about the worried well, which really applies to probably most of us in this room. The worried well are people under 60 years old who really don't have any underlying medical conditions. These people are getting up, going to work, taking your kids to school, maybe going to the gym, going to your place of worship. And what's on our mind is, what can we do to help keep the transmission rate of this virus as low as possible? So a couple things to keep in mind as we go through this is a couple things we do know. One, coronavirus is easily transmitted. We know that based on what we've seen so far. And then two, the worried well, the people under 60 without any underlying issues, are generally at low risk of having complications from the coronavirus. Two very important things to remember. So some key things we can do to help decrease the transmission rate. Some of this has already been said, and I apologize, but we really want to hammer this message home. The first is washing your hands frequently, not just before eating or after using the restroom, maybe every hour. Warm soap and water for at least 20 seconds. And again, avoid touching your face. It's hard to do, especially sitting at this table trying to not touch your face in front of all of you. It's a hard habit to break. When coughing, yes, into the corner of your elbow, but also try and use a tissue. And then after you cough or sneeze, throw that tissue away. Don't stuff it in your pocket or stuff it up your sweater sleeve like my second grade teacher used to do. In general, avoid being around sick people. So if you don't need to be in a nursing home or you don't need to visit a hospital, don't. If you're at a place of worship and there's a group around you that seems sick, coughing and sneezing, move to another spot in the facility. And on the flip side, if you are sick and having symptoms, stay home. Don't go to work. Don't attend events. People will understand. If and when you start to develop symptoms, fever, cough, shortness of breath, the instinct is to go seek care, to go to an urgent care, to go to walk-in hours at your family doctor. As Dr. Contra said, we're encouraging people to pick up the phone and have that conversation over the phone first. We're trying to encourage patients to be triaged first so that we can help identify which location is the best site of care to treat the patient and to determine if treatment is necessary. And then the last point in general, eat a healthy diet, get adequate rest, exercise. These are things we should be doing anyway, but they're vitally important when we're trying to maintain healthy immune systems. As far as at work every day, what we can be doing, the big one is avoid shaking hands. I saw it when I walked in, people doing the elbow bump. We're also encouraging the wave. I work for WellSpan. We call it the WellSpan wave. It's a little awkward, but again, to decrease the risk of spread. At work, keeping your keyboard clean, disinfected. Anything else you touch on your desk, disinfect a couple times during the day. If you go to the gym, make sure you're wiping down equipment after every use. You might want to ask the staff at the gym what's in the purple solution that you spray on the thing. If they can't answer that, you can bring your own disinfecting wipes with you. And when you're out shopping, bring wipes with you, wipe down the cart before you start shopping. The last point I wanted to talk about was the stockpiling of items. A lot of you have seen this in the news with stockpiling the water and the toilet paper. Really unnecessary at this point. It's been mentioned a few times that we should be following the CDC recommendations. At this time, they're recommending having 3 days of food and water on hand just in case. And then in general, it's a good idea to have about 30 days supply of your routine medications on hand at home. And again, to try and avoid wearing surgical masks whenever possible. One big effort that all the health systems are facing right now is conserving the equipment that we're going to need as this virus continues to spread. So please try and avoid using the surgical masks. The key in all this is, again, trying to stay calm. As has been said, we have no confirmed cases in Lancaster County to date. Just remember that health systems collaborating with government, schools, and other organizations are working hard to keep all of us safe. Thank you.
Thank you, Doctor. And our next briefer is Dr. Craig Skursinski, Vice President, Emergency Medicine with UPMC. Doctor.
Thank you. Good afternoon, everyone. A lot of what I'm going to talk about you've just heard. You're hearing the same thing over and over. Repetition in this setting is probably a good thing to emphasize the importance of what we're talking about here. So I'm going to mention briefly some of the risk characteristics that go into the high risk versus low risk, and then what do you do when you actually have symptoms. So what we have found with the COVID-19 is that folks that are over 60 or who have underlying medical conditions, this could be diabetes, heart disease, chronic lung disease, are at higher risk and therefore should take more precise precautions. All the things that have already been talked about regarding hand hygiene, avoiding large groups. In addition, they need to be hypervigilant about travel. We want to stay away from airplanes. I don't think anybody's getting on cruise ships anytime soon, but the recommendation is to stay away from cruises. The folks who are at higher risk need to take some of these precautions even more serious than everyone else. All the things you've heard about already: clean and disinfect regularly, cover your mouth when you sneeze. I'm not going to go through each of them, but all the things that have been mentioned already are important to remember for the high-risk group. So the next question that comes up is, okay, I have symptoms. What is the right thing to do? And again, my colleagues have mentioned this already. A significant majority of folks who get this virus are going to have very mild to low to no symptoms. It's important that they can stay home. Access your health care by phone. Call your primary care. Some of you have insurance providers who have hotlines. It's important to call them first. For folks who are at low risk, who have a low fever or mild cough and respiratory symptoms, going to an ER or going to an urgent care is not the best first course of action. What we're going to see is technology is going to play a role in this. Telehealth is going to play more and more of a role. A number of healthcare systems and health insurance providers will offer a visit with your provider via your phone or via a computer, and that's going to become more and more available and actually cheap, and sometimes the prices or the fees for that are being waived. So we encourage you to make contact with your healthcare providers or your insurance providers first. Next, if you need to access an emergency department, if you have some of the high-risk characteristics, or if you develop a high fever, severe difficulty breathing, you need to have confidence that our emergency departments are prepared for this. As was mentioned before, emergency preparedness does not start with one particular infectious disease. We've been through this before with a number of others, and so the emergency departments are ready. We have staff who is trained, who have the ability to use the right precautions, personal protection equipment, and to put the patients into the right level of isolation that is necessary while testing and treatment is performed. So what I want to say in closing is, again, calm, reiterate all the things that people have been saying, stay home if you can, avoid the spread. When you come, if you do have symptoms and you come to the emergency department, you can have confidence in the care that you're being given, in the care that your family members are being given, and to continue to pay attention to the CDC and the Department of Health websites for the information, all the great county-wide information that's been given here, and that's about it. Thank you.
Thank you, Doctor. Next, we have, if you're following along with your agenda, this is item 4. This is the Hospital Association of Pennsylvania briefing, and we have Mark Ross, who's Vice President, Emergency Management with the Hospital Association of PA.
Good afternoon. Thank you very much. Thank you to everyone the opportunity to be here today. It's meetings like this that show the cooperation that is taking place between governments, healthcare, and all the partners, schools, businesses, that is necessary. Lancaster County residents and those across the state of Pennsylvania should know that hospitals are prepared to respond to this disease. As the doctor said before me, we're open, we're accepting patients like we do every single day and providing that world-class care that we do every single day. Pennsylvania does not have a public hospital system, so HAP's role in this is that of facilitation and coordination. We coordinate the healthcare coalitions throughout the state. We are currently manned in the Department of Health Operations Center and coordinating the healthcare response to the COVID disease outbreak. This is done through communications with our members, daily calls with facilities, those that are impacted, resource and response coordination. Our hospitals are open, providing that care, but we need the community to help with the spread of this disease. All the things the doctors just said, I'm going to reiterate again. If you haven't gotten your flu shot, get it. Wash your hands, cover your coughs and sneezes, social distancing. If you're sick, stay home. Contact your provider. Don't just go to the ER. Call your provider. They will determine whether or not you need that acute level of care. And as the doctor stated before me, if you do not essentially need to visit a loved one in a facility, whether that be a hospital or a nursing home, think of other means to make that contact, whether that is through the phone, through video chat, but call the facilities before visiting. Make sure they are accepting visiting. Many of our members and many of the healthcare facilities throughout the state are currently reviewing their visitation guidance. Please call ahead or ask them to call you if it is necessary for you to come in and visit. This will help protect your loved ones, help protect our excellent healthcare staff, and help reduce the spread of this disease as we move forward. Again, we're prepared, we're open, we're ready. This is not a time for panic. This is a time to prepare. Finally, thank you to you members in the media for being here today and voicing that message of calm to the citizens of Lancaster County and across the state. We need cooperation as we move forward in the response to this disease. Thank you.
Thank you, Mark. Next, we have a briefing on EMS. There's many EMS providers here today, and this situation has the potential to impact them as well. So we have Daryl Fisher, who's president of Lancaster County EMS Council. Daryl?
Good afternoon. My name is Daryl Fisher, president of the Lancaster County EMS Council. I am pleased to tell you that Lancaster County is blessed by some of the very best emergency medical services in the Commonwealth of Pennsylvania, and probably the nation. So over half a century, our providers have dealt with many infections, including HIV, SARS, swine flu, influenza, and other healthcare challenges. Today, we're confronted with this novel threat of coronavirus, also known as COVID-19. In the history, tradition of our EMTs, paramedics, and other EMS professionals, we embrace these challenges, we adapt, we overcome, we persevere to provide the very best medical service and care to our citizens here in Lancaster County and our surrounding communities. We are deeply grateful for the engagement, the wisdom, the collaboration of our county, regional, and state leaders. Additionally, we in EMS, we work as an integral part of really three outstanding healthcare systems when we provide state-of-the-art medical care in Lancaster County here. In closing, I just need to remind you of just that one powerful message of if you've been exposed, travel to an endemic area, if you're having symptoms or you're being asked to self-quarantine due to the coronavirus, please let the 911 system know when you call them for our help. That way we can wear the appropriate protection equipment before we get to your house. This will allow us as EMS providers to maintain our individual safety and provide seamless continuity of patient care. God bless you, our leaders, our first responders, all of them, and Lancaster County. Thank you.
Thank you, Daryl. Up next, we have, if you are following along on your agenda, we have item 6, which is a briefing about nursing homes. As many of you know, this is a very large retirement home community in Lancaster County. We potentially have more retirement homes than any other county in Pennsylvania, and this pandemic has a potential to impact these. So we've asked Dr. Leon Crable, who's representative from Lancaster Area Senior Services LAS, which is the organization that many of the nursing homes belong to brief you today.
Good afternoon. There are 32 nursing homes in the Lancaster area. And in those nursing homes, we deal with infectious diseases every day. This is something we work with regularly, bladder infections, pneumonia, skin infections, bowel infections, influenza. We do this day in and day out, and there are very strict regulations that CMS has placed on us on infection control and antibiotic stewardship. So why, if we do this every day, are we worried about the COVID-19? The COVID-19 is somewhat different than what we have faced before. It is more contagious than the seasonal influenza that we have, more than the common cold, so it gets passed on to others more quickly, and it is more deadly than the seasonal flu. You may have seen some of the charts of the consequences of COVID-19, and this is a chart looking at mortality that breaks it out by age group. And so at a young age, the risk is relatively low. When you get up to above 80 years of age, the risk of mortality from this gets up closer to 15%. So this is significant for the people that we work with in long-term care. To have our residents in long-term care get infected, you have to have the infection get into the facility. And how will it get into the facility? It will likely be brought by visitors who come to the facility or the staff of the facility. And so that's where we have focused our energy in focusing on that. For our staff, lots of education, lots of meetings. We continue the routine precautions of hand washing and personal protective equipment and monitoring that. I will say that does not include masks on all the staff at all times in nursing homes. If the infection is not there, then not everyone needs masks all the time. Like everyone else says, if our staff are ill, we want them to not come to work. We will monitor our staff as they come in and talk with them. If you get symptoms on the job, we have protocols for assessing that and getting them out of the facility promptly if they are ill, and then the environmental controls, cleaning those high-touch surfaces of doors and handrails and buttons and equipment and the laptops. One of the biggest questions is for those visitors who may come from outside, how do we address those spouses and families and other people that want to visit? Medicare, CMS gave us fairly extensive guidelines 2 days ago, suggesting, again, we should actively screen for people coming in the door if they have any of the symptoms. The checklist of questions of what's going on, we will be screening them, and many of our facilities have a paper form that when you come to the door you will need to fill out to make sure that you are appropriate to enter. And then the question is whether, if you're not showing any of those symptoms, whether you should come into the facility to visit or not. And Medicare, as our CMS, has given two categories. One is limiting visitors to only a very severe end of life. Someone is close to the end of life or needs that for the missional well-being, and they have said we should use these guidelines if COVID-19 is in Lancaster County or an adjacent county. That is not the case right now. There's a less restriction guideline of discouraging visitors that they suggest all facilities should use. My sense is most Lancaster County facilities are moving towards the most restrictive one and asking people not to come in unless it is a very end-of-life and very dire situation that requires that. But talk to the facilities, as said earlier, call them before you go. We have been seeing some family members becoming angry when they are restricted from visiting their loved ones, and I understand that wish, but again, this is for the protection of our folks that are there, and by PA regulation, we are allowed to restrict visitors if we think that is in the best health for all of our residents who are there. We are also looking at social distancing, limiting or canceling those group events in the facilities, keeping the non-essential volunteers out, often limiting clergy visits, or have the clergy call by phone, vendor deliveries, trying to not have our residents mingle with folks from the community overall. I asked our long-term care facilities what they would like you to know about what they're doing, and they said the health and safety of our long-term care residents is our highest priority. That's what drives us. We're concerned, but not panicked. We have spent many hours discussing and preparing, and we do not take lightly a recommendation to visit or to restrict visitation to those facilities. So please respect the well-being of our residents by honoring those directions if that is given. And our knowledge and recommendations are evolving, so stay tuned and we will adjust as needed. Thank you.
Thank you very much, Doctor. Next, we have a briefing on schools, and there's a lot of discussion about school cancellations and what that's going to mean. So I reached out to the superintendents of Lancaster County. They have a group where they communicate and meet, and we have today here Dr. Brian Barnhart, superintendent of the IU-13, he's representing the superintendents of Lancaster County school districts today. So, Brian?
Thank you. When you're this far down on the agenda, you have to respect the 5 Bs. Be brief, brother, be brief. So the game has changed since we started this conference today. That's how fluid. I came with prepared remarks, and suddenly they're not really useful. I was coming to tell you that the schools have been working collaboratively, planning for what might happen in closures, and we've already seen some in the process of canceling or evaluating student field trips, athletic and social, and other non-essential gatherings. We're paying close attention to Lima and the Department of Education and the Department of Health. We've found great help from them. But since we started this conference at 2 p.m., Governor Wolf has now ordered the closure of all Montgomery County educational facilities, including private schools, charter schools, preschools, daycare institutions, and higher learning. In addition, it extends to all public places that aren't absolutely essential, like hospitals and the like. So that's going on. So that's probably a game changer for the superintendents here in Lancaster County, as they now switch from the potential for this to happen to potentially the order of it happening if we see the COVID virus grow here. That raises our concerns as a space, as a sector. You know, we recognize that over the past 10 years, the percentage of our children who are born into poverty has really grown in Lancaster County. So the closure of schools means not so good news for them. Many of them will lose up to 2 meals a day. Many of them will lose the ability to get food to take home, to eat after hours. Parents of students, especially single parents, face economic challenges as they have to stay home for care. See, because if we pull the children into other large groups for care after schools close, we really defeat the purpose of closing the schools, right? So we also recognize that some of our parents are the very first responders and medical practitioners that we need to help those most impacted by the virus. So today's solutions of closing schools without great thought lead to tomorrow's problems. So we have to be very careful in that regard. And we hear a lot of talk, especially with the pressure of our higher ed colleagues closing. They're in a different arena than we are. The ability to go 100% online with our students just isn't really there yet. How do you plan for weeks of instruction for 8-year-olds in a completely video or internet environment? It's kind of difficult. We still have places in our county that lack internet activity. They have dial-up, if that. And so that's going to be certainly a challenge. And we just know that schools are often the safe haven for students in today's age. So we're concerned about them being left home without adequate supervision. So I know our superintendents, though, they're a great bunch. They're working closely with everyone who's up here. They're working with Secretary Rivera. We have a webinar for first thing tomorrow morning, Commonwealth-wide, to hear from the Secretary of Health and the Secretary of Education on further guidance. So our situation is really fluid and got so just in the last half an hour. But I can assure you, we're doing all of the other recommendations from the CDC. We are in Uber cleaning and disinfecting all the high spot areas, high traffic areas. So every decision that we make is the one that we have with the best information at the time to preserve and protect the health and welfare of our students and our staff here in the county. So I appreciate the opportunity to come and give you a brief update.
Thank you, Brian. Next up, we wanted to include the business community. We recognize that there's going to be a lot of different pieces to this, including human resources pieces and also just us working with our partners in the business community. So Tom Baldrige, who's President and CEO of the Lancaster Chamber, representing the business community, is going to brief us.
Thank you, Josh, and thank you to Josh and the county commissioners for including the business community in this briefing. It is obviously an important part of what we believe is a community response that's necessary to combat this disease. You know, you've heard a lot so far today, and appropriately so, about words like calm and comfort and cooperation and careful, and now, unfortunately, closing. I'm frankly eager to add the word commerce to that as well, because quite frankly, the commerce of our community is another important backbone of what makes our daily living worthwhile, and it's critical that we do all we can to keep that commerce going as best we can. So the Lancaster Chamber has gotten involved with a few things that we've added to our list of offerings to try to assist with that. But then I also have a charge at the end for all of you as well. So the first thing that we've done at the Chamber is we've simply created a landing page on our website that invites all businesses that come to that landing page to get best practices from all across the country and recommendations for tips on how to manage this from the workplace perspective. It's a gathering of information that we continually add to make sure that people or companies are understanding what they can and can't do as it relates to this disease and their workforce. In addition to that, we've added a way that companies can offer up their best practices, so that if somebody thinks that they're doing something that's unique and having impact within their own company on how to deal with this issue, we're inviting them to please tell us that story so we can let everybody else in this in the business community be aware of that story as well, and we can learn best practices from each other throughout this process. Next Wednesday, we're hosting a webinar called Ask an Attorney. One of the challenging things about this issue and the business community is there are lots of rules and regulations around how you handle your workplace. And all bets are off sometimes on trying to handle this issue versus the laws that are in place, and how do you navigate that. So the idea of having attorney assistance in all this area is very important, and we're offering a free webinar not just to chamber members but to all businesses across Lancaster County for free, so that they can talk to an attorney online and get the information that they need. And then we've also taken our weekly emails. We send an email to all our members on Tuesdays and on Fridays. And for the time being, those emails are going to be populated with all things coronavirus to make sure that people are continually getting the latest information, not so much on the facts and figures of what coronavirus is doing, because I think there's lots of other and better sources for that, but rather how the business community or specific businesses are managing this issue so that we can continue to put out information and learn from each other. So those are some of the practical things that are going on in the business community. Here's the challenge to our broader community. The fact of the matter is we can't simply shut down and think we'll get through this crisis. And I'm inviting us to think creatively about how you can play a role to help. I get you might not want to go out to dinner, but perhaps you could order takeout and go pick it up from that same restaurant. I get that you might not want to go to a movie theater, but even going to a movie theater and buying a thing of popcorn and taking it home to watch a movie at your house is a help to that small business that's trying to figure out how they're going to make it through this whole thing. I get that you might have some employees that now you don't know what to do with, and maybe over the past 5 years in this go-go economy where you've had all these projects that you wish you could get at and you never had the time to, now's the time to redeploy those people to get those projects done so that you're not having people forced out of a position, healthy people forced out of a position that could be an income for them. So I'm asking us all to think creatively, think individually, think about ways as your company and ways as importantly as an individual consumer that you can do your part to be safe, be careful, be healthy, and keep our economy strong. Thank you very much.
Thank you, Tom. So lastly on your agenda, item 9, as my colleagues, Commissioner Lehman and Commissioner D'Agostino mentioned earlier, there are a number of functions, certainly in county government, that we have to continue to do. Elections. We have things like the prison. Our warden, Cheryl Stieberger, is here today. And certainly, we also have the courts, which no matter what happens, we have an obligation to continue to run the courts. So we're pleased to have President Judge David Ashworth with us today, just to give us a briefing on what continuity of operations with the courts looks like.
Thank you, Josh. I joked with the commissioners earlier to thank them for allowing me to bat cleanup here just before all the questions. But the reality is, making reference to a sporting reference, we're not like sporting events. We can't just cancel events. We have a constitutional obligation to keep the courts open. With that said, however, we have certain areas, procedural guidelines that we follow. And the first thing is, back in 2008, we put together a continuity of operation plan, or a COOP. And we are following that very closely. It is updated every May 1st, and it provides certain levels, essential levels and functions of things that we must continue to provide. The Board of Judges and I are sitting down next Tuesday at our Board of Judges meeting and evaluating what services, what things we must continue constitutionally, and what things we can temporarily cut back on during this situation. We are also governed by the Pennsylvania Rules of Judicial Administration for continuity of operations, emergency actions, and emergency unions. It's a mouthful. But what it does, it provides for and requires us to have a COOP. It provides and requires us to follow a continuity of operation plan. And it also directs us to use the Pennsylvania Public Health Law Bench Book. So with these three areas used as guidelines, and on a daily, more than daily basis right now, I am receiving, and our court administrator is receiving notifications and updates from the Administrative Office of Pennsylvania Courts, or the AOPC, which is the administrative body of the Supreme Court, directing us and leading us to and keeping us advised of things that are going on. It was mentioned earlier about Montgomery County. I just received this afternoon notification that President Judge Del Ritchie from Montgomery County has implemented a plan which restricts quite a number of things. It reduces the number of jurors summoned on a daily basis. Obviously, we have the ability to cut back if necessary on things such as civil proceedings or civil matters, but criminal matters we have less flexibility with, and we must continue to proceed with those matters. But the jury selection process, the juvenile court, orphans court, all of these things are taken into consideration, and Judge Del Ritchie has already begun implementing a plan there. I also received a copy of a Supreme Court presentation or announcement from New Mexico. Their Supreme Court has done similar type things, and we are in the process of evaluating that for Lancaster County as well. So I assure you that we're not just sitting on our hands. We are paying attention to this, and we are addressing it as expeditiously as we possibly can. We are taking this very seriously, but I would like to echo all of the other comments. People need to remain calm, and I realize, and in the court system, sometimes it's very difficult to do so. Sometimes tempers flare, sometimes people get anxious, and I would just ask for everyone's cooperation and patience during this time. We are working on this, and we're doing everything we can to make sure that we can maintain the proper court proceedings and the court procedures, but we need everyone's help. Thank you.
Thank you, Judge Ashworth. And just a couple of quick notes. One, I'm very, very thankful, and I know my colleagues are as well, for all the leaders that are up here, and especially the leaders in the medical community who are collaborating so well with each other and with us, and for all the leaders across Lancaster County who are doing the work now to prepare for this. Two, just wanted to note, County of Lancaster, county government, our website, we have a page devoted to this, which has vetted information that our emergency staff, EMA staff, are updating with vetted, correct information and facts about Lancaster County. Of course, you can also get information from the CDC website. So just in closing, I would say, again, you can see all these leaders today are working. They're calm, they're careful, and they're collaborative. And we're going to continue to do that as we progress through this. And so we want to make sure that we left plenty of time for your questions. I anticipate most of them will be for the medical staff, and so I'm happy to take those questions and then make way for them to answer them. Carter.
Yes, I'm wondering what's being done to keep the Amish community informed and how you guys are helping to fight misinformation in that community.
It's a good question. Any of the medical staff, any thoughts on that? So the question, in case not everyone heard it, was communication with the Amish community. I think, obviously from the county government perspective, emergency management perspective, we'll have to think about that. I don't know that we've talked about that specifically. We certainly have contacts. I know that some of the medical community have contacts. I know Dr. Rehart at LGH has contacts with the Amish community and has reached out to them about safety projects before. So we'll maybe have to think about that. If, Phil,
I can add.
you might want to come up here to answer it.
Sure. Many of the volunteer fire companies in the county have quite a bit of Amish folks within the fire department, and obviously we're pushing all of this information down to them as well. So it's not as easy to do to get that information to that community, but we are working on that. Hopefully it's going to disseminate out, maybe not as quick. We understand that there may be a medical facility that's in the eastern part of the county that we're trying to loop into our communications so that, and they cater much to the Amish, the plain sect folks, even some of the Mennonites. So we are working on a couple different fronts to try to get that information to them, but it's hard for us to know because we don't really get any feedback. It's pretty much a one-way thing. So, and they do pay attention to the paper and some online stuff that they get a hold of. So we're trying to do the best we can.
I'll also add, our situation reports are going out to all the municipalities, and we have 60 municipalities in Lancaster County. A lot of those municipal officials have closer contacts with the Amish communities as well. Other questions? Yes, sir?
I heard Mr. Barnhart mention some of our most vulnerable families. I'm wondering what else is in the works for low-income or homeless people who might not have access to many of the strategies you all shared with us today.
In the medical community, want to field that? Certainly, we in county government have very close collaboration with the coalition, the homeless coalition. So we'll be working with them. I mean, there are so many different avenues to this that it's going to require, the reason you see so many different people here, so many different briefings, is it's going to require all of us in our different lanes to be thinking about how we're preparing for this. Commissioner?
Was your question specifically about schools?
No, I was just grateful for Mr. Barnhart
Okay.
for bringing up our low-income families and their children.
Right.
I really hadn't heard anyone else speak to strategies for low-income families, families that are $400 away from losing their home. We're telling people to stay home from work. We know that this is part of our dialogue. So my question is very specifically, what are the rest of you thinking about? What are our specific plans to help those families and the children of those families as well?
Well, all I can say is that I know that right now the federal government is looking at dealing with that with regard to making sure that people who have to stay home, looking at ways to make sure they have a paycheck. I know businesses, I don't know if, Tom, you have specific guidance from, that you mentioned on the website. I know in county government we're talking about what steps may be taken at some future point. We're not there quite yet, obviously. We don't have any cases here. We are discussing those things and how to deploy things. With respect to the homeless, I am a member of the board of directors for the Homeless Coalition, and we will be discussing that in terms of getting the information out to them, to the people who, different shelters, different housing areas where they go, and we can certainly get that information out.
So I just want to add for everyone in the room that it's not meant to be a gotcha question, but it is definitely meant to be something that let's all take a moment to think about what did we hear about that today before the question was asked, and what can we all be doing to make sure that we're asking our community to do the best as we would hope that Lancaster County would want to do, to make sure that our most vulnerable people are going to make it through this, and that we're not, it's a fairly homogenous table. So to make sure that we're thinking about different perspectives and people who might not have the advantages that many of us in this room have.
As a matter of fact, you have two of them sitting right here.
Thank you. Thank you for the question and for the comments. Other questions, comments? See the doctor making his way up. And the question, in case everyone didn't hear, is what will testing look like in Lancaster County?
So remember that up until very recently, all testing was routed through the DOH using the CDC's certified test. Commercial testing has become available by at least 2 laboratories. I know that the University of Pennsylvania is getting ready to launch a test of their own, probably next week sometime. So ramping up of testing capability is certainly in process. What I think and we can and we are testing people now. We're trying, however, to be stewards of the resources that we have and to provide those testing for the patients for which it is most important to know the answer. So in other words, we're not looking at this point to do widespread surveillance of patients with no symptoms. While that may come at some point in the future, I think that's got to be down the road when our testing capability ramps up quite a bit more than it is now. I mentioned earlier that at LGH we're looking to establish an off-site place for patients to come and get testing that's ordered by their physicians. That would involve an unloading of the ED, of the emergency room and urgent care, so that we could get patients tested quickly and efficiently once we get testing ramped up a bit more. But again, there is now commercial testing available. There's some University of Pennsylvania testing. I'm not sure if UPMC has something coming on board soon. But I think the opportunity to get testing is right around the corner. And in fact, is happening now.
Yes, ma'am.
Yeah, so I just want to introduce myself because I have some information here. My name's Tammy Rojas. I'm a member of the Lancaster Healthcare Rights Committee with Put People First PA. We are a statewide grassroots human rights organization led by the poor and dispossessed. I'm also on the state coordinating committee for the Pennsylvania Poor People's Campaign, a national call for more revival. The issue with this coronavirus here in the United States versus some of the other countries is the reality that wealth inequality and poverty is very severe in this nation. And even when we look at, for example, Italy, right, they had to quarantine 60 million people. The things that they have done have actually stopped mortgage payments and they stopped debt payments. Those are things that our government's trying to negotiate right now, and I think it's really honestly saddened because the numbers that are coming out because of our healthcare system is nowhere comparative to some of these other countries who have faced detrimental effects, right? So we need to understand that here in the United States, it has potential to be very severe. They're estimating anywhere from 75 to 150 million people in this country could be contracted with the virus. The number of this nation who are poor or low income, that means who are living in poverty or one $400 emergency away from poverty, happens to be 140 million, right? If we look at a death rate of roughly about 1%, we're looking at a potential of 1.5 million people could possibly die, right? So then when we look at the numbers, one of the things that our group has been doing this past year, not only have we taken action on the closure of St. Joseph Hospital, and are here to demand that we need to really seriously look at utilizing that building for what we're gonna need here, because things are gonna be a lot worse than what we're honestly talking about right now. And we need to be prepared for that. We have an empty hospital sitting right there. We need to utilize that. The other thing that we have been working on is doing research for an audit and moral budget for Lancaster County, much like the Poor People's Campaign did for the nation and delivered to Congress. What we have discovered as far as poverty rates, so if we're looking at the fact that it's matching the numbers of people who are poor, right? We are possibly looking at, okay, so Lancaster County is just
Ma'am,
under 28%
I'm just gonna ask
poverty.
if there's a question there, because,
It's all relevant, again.
Okay. Is
Like,
there a
we need
question
to
there for the
address this.
panel?
We have just under 28% of our county is severely in poverty right now. For Lancaster City, we're at roughly about just under 50%. In Columbia, 45%. So if we look at the numbers of who could be contracted and who could die for that, we're looking at possibly 1,400 people in Lancaster County, just roughly calculating the numbers. So we need to look at the fact that people like myself who have an autoimmune disease and I'm uninsured thanks to our current system and the difficulty to apply for benefits, I am at high risk, so my life is on the line. Much like the people of the numbers that I just mentioned. So we need to take this seriously. And all I heard was repetitive things that were that we should take that I can't afford to take.
We can't afford to stockpile anything. Despite working 40 hours a week, I'm homeless. I'm sleeping on her couch only because she's allowed me to. I don't have health insurance. You haven't said anything about people that are uninsured. It's always go to your doctor. I don't have a doctor. Urgent care isn't gonna take me because I don't have money to pay.
Thank you, ma'am. Is there any members of the panel want to address anything there? We'll get with you afterwards, and we'll talk to you
No,
more.
we
on
want
that.
answers now so that the media can hear. We
The
don't
people
want the
even-
later when behind closed doors.
Why are we
want
not
them now.
utilizing this old St. Joseph Hospital? Like that, like, we need to understand that this is gonna go beyond just Lancaster County. When that hospital closed, it affected the surrounding counties. It affected the EMS services. We need to utilize that building. There's no ifs, ands, or buts. There's no reasons, no excuses. That building should be prepped just in case.
Thank you. Anyone? Okay, are there other questions?
There are no answers then, right? We have no
Carter?
answers.
For the medical community, how many severe cases could each of your facilities handle and still treat your normal number of patients coming in?
So all the facilities in the county are looking at our surge capacity. What things can we do to offload patients that are now coming in and take care of more patients? Part of that is redistribution of patients within the hospital. There may be scenarios under which we need to cut back or stop elective procedures coming into the hospital that could wait until another time in order to free up not only bed space, but then also personnel who would work in perioperative areas who could then come and help with care of COVID-19 patients. We are also exploring regional solutions, both in terms of the central Pennsylvania and with the UPHS health system in my situation, and of course UPMC as well. The issue of the reopening St. Joseph Hospital has been addressed. There's not been a final decision made about that, but it is being explored.
Okay. And would you have a figure on how many days worth of masks and respirators you have?
It would depend on how many patients we have and how severely ill they are. So, I mean, we have stockpiled as much as we can stockpile. We're tracking within the Penn system, each entity, each of the 6 hospitals, what our supplies are. Do we have to share with hospitals that may have more patients than others? All those things are being investigated. At this point, I can't give you a number because it depends on the circumstances.
You mentioned the importance of social distancing to potentially stop the spread. I'm wondering if you are recommending or encouraging the cancellation of large gatherings, and if so, is there a number on that?
Well, you've probably heard different numbers depending on who you're talking to. Is it 1,000? Is it 25? I think we just have to use common sense and say if you have a gathering of a number of people, how many of them really need to be there? Is it something that could be done virtually? There are many meetings now that could be done online, and I think those kind of opportunities need to be pursued. I can't give you a number as to what the maximum number of people is, but as we begin to see more cases, that number is going to shrink.
Governor Wolf just released, he's encouraging no gatherings of over 250. Is that a number that Lancaster County is comfortable with? Are you going to follow that guidance, or will those numbers be different?
I'll certainly invite Phil up, but as of the time that we walked into this briefing, there was no hard guidance on that yet from either the federal government or from the PA Department of Health. You know, we're certainly, working collaboratively with them and want to be aligned with them. So if that guidance comes out, I would anticipate that we would be supportive of that. But if Phil has anything to add to that,
No, that's exactly what, we're gonna follow the Department of Health guidelines. So far for Lancaster County, before the meeting, we did not have any guidance. That could be different right now.
And I just want to reiterate what was mentioned earlier. The healthcare systems are working at expanding our capacity. So that includes physical space, staff, resources that would be necessary to this. So all the projections have ranges to them. So it's difficult to know exactly what's going to affect this county and this region. But our healthcare systems are preparing above and beyond our normal resources with surge capacity, with multiple different plans. And I think I do want to say one thing from an emergency department standpoint. I stood up here and mentioned all the options you have to stay out of the emergency department. And one of the reasons for that is because the emergency department is the community safety net. And our emergency departments are open, and we see everybody. Anybody can come to our emergency departments, and they will be seen and they will be cared for. One of the reasons it's important for people who have access to health care appropriately in another area is to make sure that our emergency departments maintain that capability that we are dedicated to.
Other questions? Yes, ma'am.
This question is for Dr. Barnhart regarding children who might be relying on the school system for meals. What are the, I guess, ideas to, in the event of a 2-week closure, because that's what we've been hearing about, feed them basically, maybe taking your cues from whatever happens during the summer, partnering with those organizations.
Right, we've got volunteer organizations in the.
Can you answer up here so they get on the mic? Maybe repeat the question.
Thanks. The question was about what provisions can we make for children who might go without meals in the event of a long closure of schools. So you have some community organizations like Power Packs that work in collaboration with the schools, but they may continue to serve and just set up different pickup points. I can't speak on their behalf, but that's something that I would suspect. I've been in touch with Dr. Rao from the School District of Lancaster, and I know as long as they're able, if they're forced to close, they're going to try and continue to provide meals for student pickup within the city of Lancaster. I believe that was the case that I saw from her. I would encourage those parents of children most likely impacted to check their school's website. The schools are posting updated information as we speak. There's going to be a lot more information released from each of them tomorrow following the press conference with, not the press conference, I've got press conference on the mind, following the webinar with Secretary Rivera. I know they intend to release some statements then once they're able to collect the most updated information.
Ms. Barnhart, I might ask another question. If parents elect to pull their children out of school, will those children face any kind of repercussions in school? Has that been discussed?
So 17 different districts, including Octorara in the county, they may each vary on this, but I suspect they're all having conversations about relaxing some attendance rules with regard to parents who want to keep their children home during this uncertain time. That's certainly the prevailing conversation that I've heard.
Has there been any discussion about the mud sales in Lancaster County?
Yeah, there has. We have Adam Bills here from Salisbury Township, or Paradise Township, sorry. And I think they just put out some guidance recommending that I see you're getting past their letter recommending that the mud sale not happen. I think it's the Gordonville mud sale not happen, but that's going to be up, unless the governor makes a declaration, that's going to be up to each individual organization that's doing that, at least as of this hour. So we'll see as things go, but good question. Yes, ma'am. With regard to medicine specifically, any of the medical team want to take that?
I would just encourage patients to reach out to their practices. I know in our WellSpan offices, we have health coaches in all the offices that can link them up to community supports. They're also in contact with the social workers at the hospitals. So there are plenty different agencies out there that can provide care and delivery of services to the home.
I'm fairly confident CVS has dropped any delivery fees, and that they're now delivering medications for free.
Other questions?
Maybe just one other question. The proximity to Montgomery County, to Lancaster County, for TV folks, this is an area where we cover, we're the closest to Montgomery County for TV purposes. Not that that means anything for anybody else, but like, we have folks who travel to Montgomery County. Is there like a concern if somebody travels to that area from Lancaster County? Are we urging them not to do that as like veterans folks?
I don't think we've gotten any, look at Phil, I don't think we've gotten any guidance on that. I mean, my understanding is there, at least as of coming in here today, there was about 9 cases in Montgomery County. I mean, certainly there's other areas in the country that have many more cases than that people from Lancaster County sometimes travel to. So I don't know if the medical community wants to add anything. I'm sure that anyone who's been to an area that's impacted, they're urging caution, but at this point, everybody probably needs to be cautious. So if anybody has anything to add to that, I welcome you up. Other questions? Well, thank you all, and we'll look forward to try to continue to keep you in the loop as we go forward.